Over the last 10 to 20 years, I've done tens of thousands of dermal filler injections and hundreds of thousands of Botox and Dysport injections. And it really does take a complete focus to be a master of the art of injectables. One of the big parts of the field of cosmetic medicine are the use of these dermal fillers and other injectable agents. Botox, Dysport, Xeomin, these are agents that slow our muscles down and they decrease the wrinkles we see, and actually they can affect the shape of the brow, the shape of the eye, and other parts of the face. We do these very conservatively, so you can't tell they've been done, and they actually help us age better as well. The use of injectable fillers is an art in itself, and it's something that takes years and years of training and thousands of patients to really master the craft of this. There have been an explosion in the number of new dermal fillers on the market today. There's Restylane, there's Juvederm, there's Belotero, there's Silk, there's Voluma, there's Sculptra. I can keep on going. Fillers continue to improve year after year. We use about 20 different fillers in our practice. In Europe, there's about 100 different fillers, and that's coming our way. And we use most of these. And colleagues will ask, well, why do you use so many dermal fillers? I only use one. And the reality is they're all different. They each have their own attributes. If we're treating a woman's lips, for example, are we trying to create volume in their lip? Are we trying to create a better border in their lip? Are they bothered by the little lip lines that they see in the white part of their lip? Do they not like the crinkles in the red part of their lip? Each of these indications are best treated with a different type of dermal filler. So depending on what the patient's goals are, we're going to offer them the best tool for the job. Years ago, we used to chase lines and wrinkles with fillers, and today we use them a very different way. We use them to revolumize the face, to help regain youthful contours. We'll use them to improve the jawline, to decrease jowls, to improve the shape of the nose, to lift the eyebrows, to help the lids, the lips. So they're used in many, many different parts of the face. And in the hands of a skilled injector, you really shouldn't be able to tell where they've been used. The face should just look more youthful and rested, and that's it.
I was concerned about the results from Botox. I've seen people who have a very frozen look. Their face is very stiff. They don't look natural, and that did concern me. But when I came here and I spoke with Dr. Chasen, he gave me an explanation as to what I needed, what my needs were, not overall in general.
Part of our goal of dermal filler treatments is to make this a treatment that someone can fit into their daily life, something they don't need to take time off of work for. So we need to try to decrease swelling, bruising, any discomfort afterwards. And one of the big advancements in this field are the use of what we call cannulas. Cannulas are little flexible tubes that don't have any point at the end. So they're much gentler to use than a needle. They hurt less, they cause less bruising, they cause less swelling. There's a bit of a learning curve, so you want to make sure that you're seeking care from a practitioner who has extensive experience with cannulas. But once you're injected using a cannula, you'll never go back and ask for a needle. They really are a tremendous advantage. And I'll use these cannulas to inject cheeks and lips and under eyes. And it makes the treatment very, very comfortable, and again, limits the bruising and downtime. Another one of the advancements in dermal filler injections is the use of a technology called AccuVein. And AccuVein gives us the ability to look under the skin, actually see where the veins live. If we can avoid those veins, we can avoid a bruise. Bruising is, to me, is just not something we want to see. And though some patients say, well, is it going to go away? And I say, yeah, it's going to go away. I don't want to see a bruise. I want that patient to go right back to work, right back to their life, right to dinner, and not know anything happened. So the AccuVein has been a big advancement for that. Patients should be very selective about who they choose for dermal filler injections. These are happy treatments, but these are medical treatments, and they do have poor outcomes if not done properly. So one wants to choose someone with experience, with knowledge, and one wants to choose a facility and a physician that does this all day long, every single day, every single week, every single year, for year after year after year. It's those individuals that are going to give the patient the best result, the safest result, and the most natural looking outcome. At Reflections, only physicians are performing these cosmetic injections. And not only are these physicians trained well, but they're also very experienced.
The plastic look from Botox is very much a concern of mine, and Dr. Wicks-Harris assured me she was using a very small amount, and I don't think that it is an artificial look for me. I still have movement in my forehead. I didn't want that plank look, and I didn't get it. Very happy with it.
So speak to friends, speak to relatives, look at review sites. Make sure the practitioner that you're seeing is a physician that is adequately trained and sufficiently experienced to do the kinds of injections that you desire.
I often recommend to my friends to go to Dr. Chasen. I think he's excellent with Botox, and he's skilled at how to inject it, and I'm very pleased with the results.
I feel at least 10 years younger. No one ever knew that I got anything done, and that's what I love about it. It's just kind of it boosts your confidence to look in the mirror and you don't have to worry about lines or wrinkles or, anything deflating. I think that boost in your confidence that you can just go out and conquer the world, there's nothing like it.